Hi, my name is Bobby Lloyd, and I'm a family nurse practitioner student at Eastern Kentucky University. This is a project proposal for NSC 892, and it's about health promotion in the rural population. Health promotion, including healthy eating and living an active lifestyle, is a major topic in the modern prevention of chronic diseases. Rural populations are known to have higher incidences of chronic diseases and an overall less healthy population. Several studies were reviewed and analyzed to determine the reasons behind rural populations being less healthy. The studies showed that people living in rural areas have less active lifestyles and eat less healthy foods, thus causing a decrease in the overall health. Primary care providers have the ability to promote healthier lifestyles in all patients, especially those living in rural areas. This project proposal addresses the necessary steps to implementing a routine health promotion conversation into daily practice, as well as studying the results of this health promotion intervention. The target audience is patients aged 18 to 50, those willing to have a health promotion conversation with their primary care providers, and willing to commit to following up to discuss progress at 6 months and at 1 year. The studies that were chosen gave a comparison between urban and rural populations, examined healthy and unhealthy lifestyle choices, such as eating habits and physical activity, and also reviewed the effectiveness of health promotion in the rural population. The studies chosen also studied factors contributing to poor lifestyle choices, such as grocery availability, transportation availability, open space for outdoor activities, and financial status. These studies show that rural populations are less healthy than urban populations and that there is a great need to promote health in this population. It also noted that health promotion seems to be an effective way to address poor lifestyle choices. Evidence has shown that eating healthy and increasing activity level has a tremendous impact on health and chronic diseases, including obesity, heart disease, diabetes, etc. Healthcare providers in all areas, but especially rural ones, have to put a major emphasis on making smart eating choices and living an active lifestyle. The evidence was clear that there is an issue with the health of the rural populations, and having a health promotion conversation at primary care office visits is the recommended practice change. First, a team will be recruited by compiling flyers with information about the project and going to primary care offices to speak with providers and pass out the flyers. In order for the project to be successful, a minimum of 3 to 4 primary care providers will be willing to participate. My responsibilities will include recruiting the team, organizing the information, and scheduling team meetings. After the team is compiled, a meeting will be scheduled, and at this meeting we will discuss what kind of questions we're going to ask participants, as well as any other ideas for the execution of the project. Willing participants will need to be clients who are ready for a change. They will also be clients who live in rural areas and are aged 18 to 50 years old. They will need to be willing to have a health promotion conversation with their primary care provider and willing to commit to following up to discuss progress at 6 months and again at 1 year. In order to implement the project, the participating primary care providers, along with the project leader, will develop specific questions to ask each patient. These questions will be regarding daily activity and dietary habits and will be asked in a non-judgmental manner. The provider will speak to the patient about the effects that dietary and activity habits can have on short-term health as well as long-term health. The provider will ask each patient to make an effort to improve dietary and activity habits and request a follow-up visit in 6 months and again at 1 year to track progress. The participant's body mass index will be calculated, as well as their current risk for chronic diseases. After each visit with the client, a summary will be submitted to the project leader via secure email to compile and store results. The project leader will store all data on a password-protected external hard drive. The results will be compiled and counted manually due to the small sample size. The timeline for this project is over an 18-month period, including follow-up visits and data compilation. Consuming a healthy diet and living an active lifestyle has been publicized as something extremely important in reducing one's risk for chronic diseases. Every area of the U.S. has issues with high rates of chronic diseases, most of which can be prevented. but rural populations have even higher rates. This increase of chronic diseases in rural populations can be contributed directly to the lack of a healthful lifestyle. Evidence has shown that implementing a health promotion program in the rural population is effective in improving health status, therefore reducing the risk of chronic diseases. By implementing this project, the primary care provider can implement a health promotion conversation with patients on a routine basis in order to improve health status and decrease the risk of chronic diseases.